Welcome to Jackson County Memorial Hospital. Thank you for choosing us as your guide and partner for your orthopedic care. This educational video will prepare you for your knee replacement surgery, giving you the information of how to prepare for your surgery and the knowledge of what to expect afterward.
Once you and your doctor have decided that surgery is needed, the doctor will go over the risks and complications with you, as well as discuss any pre-op clearances you may need from your primary care and/or your cardiologist. The nurse will then discuss with you when you would like to have the surgery performed and choose a date. She will then schedule the surgery date, your pre-op date, and your education class. You are encouraged to attend the education class as it will give you vital information on what to expect before, during, and after surgery, as well as the services you will need for a speedy and safe recovery once you go home. The nurse will call you before your surgery to discuss any medications that need to be discontinued pre-op and answer any questions you may have. When you arrive for your scheduled pre-admission appointment, enter through the main lobby of the hospital. Go to the pre-admission office, sign the clipboard on the wall, and have a seat in the waiting area. Bring your insurance card, photo ID, and a complete medication list to this appointment. You will then meet with the pre-admission nurses. These nurses will discuss your health history and medications, as well as your pre-operative instructions to prepare you for your surgery. The afternoon prior to your surgery, a member of the same-day surgery team will call to notify you of your arrival time. Your arrival time will be approximately 1.5 to 2 hours prior to your planned surgery time. On the day of your surgery, you will be greeted by a member of the same-day surgery team on the second floor. At this time, you will be taken to your pre-op room and change into a gown. A same-day surgery registered nurse will then take your vital signs, review your medication list for any changes, and start your IV. The nurse will also tell you about the OR Big Board that will help keep your designated caregivers informed of your progression throughout the day. Approximately 30 minutes prior to the start of your surgery, you will be taken to the operating room holding area on your stretcher, and your caregivers will be taken to the waiting room. While you are in the holding area, you will meet your anesthesia provider and a nurse from the operating room. You will visit with your surgeon, who will confirm the location of your procedure and mark the surgical site with his or her initials on the operative limb prior to your receiving anesthesia. If you have any questions or concerns about your procedure, please ask. After surgery, you will go to the recovery room to be monitored by a registered nurse for approximately 1 hour as you awaken from the anesthesia. You will have heart monitors, a blood pressure cuff, and oxygen connected to you. If you are in need of pain medicine or you are feeling sick, let your nurse know and we will do our best to make you comfortable. When you leave the recovery room, you will be admitted to a private room. Your care team will consist of RNs, LPNs, CNAs, and physical therapists. Immediately after coming to the floor, we will monitor your vital signs. Your pain level will be monitored frequently. You may have oxygen and a catheter. You will be instructed to do breathing exercises with an incentive spirometer. Treatment of your pain is very important to us. You will receive pain medication via IV or orally. Our physical therapy team will be there to assist you in getting up and walking in the halls once or twice each day. You should expect to be up walking either the day of or the first morning following your surgery. They will also set up a continuous passive motion machine called a CPM. This will keep the knee joint moving so you will have improved function. It will be applied intermittently during your acute care stay. Your physician will be in control of your care while you are a patient at JCMH. Prior to your discharge from the hospital, you will be visited by a Discharge Planner. The Discharge Planner will work with you and your physician to make certain you have the equipment and any follow-up care your physician feels is needed. This could include transfer to a skilled nursing facility or a swing bed facility, discharge home with home health care and physical therapy, or outpatient physical therapy services. Following discharge, you may be referred to outpatient physical therapy. JCMH Rehabilitative Services or the physical therapy team of your choice will assist you with the rehabilitation of your new knee. They will create a program that strengthens your knee and helps you regain your range of motion. This plan will be customized based on your age and activity level. Home health care physical therapy after total knee replacement focuses on improving strength, range of motion, and decreasing pain and swelling. In order to return to maximum functional levels, therapy includes working on safety in and out of home, balance, and activities of daily living. We help instruct patients on the use of equipment and assistive devices. Continuous passive motion, or CPM therapy, will help you regain your mobility quicker. You will use the CPM first as an inpatient and continue the CPM therapy in your home after discharge. The CPM machine may be rented for up to 21 days from Home Health Products or your medical equipment provider. Your first follow-up visit will be 2 weeks after your surgery to check the wound, remove staples, monitor CPM machine progress, and how physical therapy is responding.
Thank you for choosing Jackson County Memorial Hospital for your orthopedic needs. Be sure to follow your surgeon's instructions after surgery. Our goal for you is improvement in the activities of daily living. Taking care of your knee replacement and general health are important ways you can contribute to the final success of your surgery.